Good morning, everyone, and I appreciate you joining us today. As many of you know, today is Behavioral Health Day at the Legislature, and it's the perfect time to announce our newest behavioral health initiative comprised of a clinician, a peer with lived experience, and a case management profession. The community engagement teams will take referrals from warm lines like the New Mexico Crisis and Access line, as well as local law enforcement.
I just am here to applaud anyone that is out there in community engagement. People with mental illness need that support system. We need the support of the money that comes. We need the physical support of people who are out there working hard to help people with mental illness.
Our jails should not be the only way people can get mental health care. It is essential that we use non-crisis situations to proactively prevent crisis and connect people to proper care. The community engagement teams will do just that.
We really are focusing on key aspects of our program. One, we want to make sure that we offer public safety to our communities through an integrative model that also embraces trauma-informed care approaches. We truly believe that when we engage community members that are in crisis, we shouldn't be re-traumatizing them through that engagement. Part of our work in this community initiative is to also celebrate recovery.
We've seen families struggle to come to terms with a behavioral health condition, and they didn't have any place to go. Now, they'll be receiving guidance from experts and peers who can relate to the situation and have already navigated it for themselves and others.
It's a $500,000 pilot program, and it's funded by the Behavioral Health Initiative, which connects several of the currently existing programs to create a continuum. And this will be paid for, tell me if I'm wrong, from the behavioral tax that the community, fortunately, the citizens of Bernalillo County decided to step up and do what they could locally to fund this problem.
Our community engagement teams are really focusing on 4 or 5 specific areas: access to health care, access to mental health and behavioral health, access to substance abuse services and treatment, and especially looking at offering people case management to manage their life as they get into and connected to services.
I want to announce that our director, Bernalillo County's Behavioral Health Services Director, has been given the Behavioral Health Star Award by our state. Yay.
I just want to thank all of you for coming. This has been a great 2 days of behavioral health, focusing on prevention and focusing on what we can do for our community, starting out with the Behavioral Health Collaborative and the conference that we had, and then ending up with what we're doing today, which is meaningful community engagement teams. So I appreciate that. The award that was given to me, again, is really not my award. It's really because the money evolved from the community, and this is really a community effort. It's really our subcommittees, it's my staffs, Margarita's, Fran's, the people who aren't here. I just can't thank you enough. To be nominated by my mentors, incredible, and to understand that you were nominated by 4 people that you respect and admire is overwhelming and very humbling. And I said it yesterday, I'll say it again, these are the people that stood shoulder to shoulder with me, stand in front of me, and often are behind me, holding me up as we push forward to pioneer and blaze the trail for what we need, not only in Bernalillo County, but in the state of New Mexico for behavioral health. So thank you.